The following segment is sponsored by Renown.
Breast cancer is the leading cause of death among women in the United States. The good news is that routine screening can lower your risk of dying from breast cancer. Joining me now is Dr. Julie of Renown Health Imaging. We're talking about breast screenings, and thank you so much for joining us. There's so much to really talk about these days when it comes to this topic. It used to just be simple with a mammogram. Let's talk first about when you schedule a mammogram, you hear about something called priors. What is that, and what do we need to know?
Prior images are basically your previous mammograms that you've had, if you've had previous mammograms. They're important to have because when the radiologist is reading the mammogram, they compare to old studies. And if they see a finding that might be a little suspicious, they look at old studies, and if it's been there for 5-6 years, it's a benign finding, and you can say that with confidence. If you don't have the priors, you might need to be called back for additional testing.
So they're looking really for that little change, and they can look at your previous.
Right, we're looking for interval changes, and we can get them from across town, out of the city, out of the state.
Right.
We've even gotten them out of the country on occasion.
Wow, okay. And we've heard a lot lately about dense breast tissue. How would you know if you had DBT? Dense breast tissue,
the report that you get from your radiologist after they've read your screening mammogram.
Your first one?
Your first one.
Okay.
Will show if you have, the report will say you have dense breast tissue or not dense breast tissue.
Okay.
Additionally, each patient who gets a screening mammogram gets a letter sent to them, and in your letter it will also describe your density of your breast tissue. There's two different types of dense breast tissue. There's a heterogeneously dense, you might see that term. About 40% of women have that, which is about moderate density. And then you have extremely dense breast tissue, which is about 10% of the population will have extremely dense breast tissue.
Okay, and if you do have dense breast tissue, what is the recommendation, especially if you're in that 40% category?
If you have dense breast tissue, you can have supplemental imaging, screening imaging done, such as an automated whole breast ultrasound. It's not required, it's just an option. It's a screening test, it's not a diagnostic ultrasound, it's just a screen, kind of like the mammogram. But it's important that you still have mammogram to go along with the ultrasound.
Okay, so mammogram would be kind of the primary, and then anything else would kind of be just in addition to that for a little bit more
correct. Yeah,
feeling.
The screening mammogram is the only medical imaging test that's been proven to reduce breast cancer deaths, so it's important that you get that. Even if you have dense breast tissue, we can pick up calcifications, distortion of the breast tissue. The thing that the screening mammogram might be fall a little bit short on is if there's a lump or a mass, because it'll be white and the breast tissue is white, and that's where the supplemental ultrasound may be of benefit.
Maybe it just gives you a little bit more confidence that everything is okay.
And it's important that you talk to your primary care provider when you get your results, and if you have dense breast tissue, ask them kind of what the recommendation might be.
Typically, are those additional screenings covered by insurance if you do have dense breast tissue?
The screening breast ultrasound is often not covered by insurance. Occasionally it is, but oftentimes it is not.
Okay, and is it $100?
It's around $100, $125 typically.
Okay. All right, well, thank you so much for that information.
You're welcome.
Nice to see you. If you have any more questions about mammograms or dense breast tissue, any of these topics that we've been talking about today, you can go to bestmedicinenews.org.